This is Bringing Better Health to Life, a program brought to you by Conway Medical Center. My guest is Dr. Arthur Presslar. His friends call him Jay, and he is affiliated with Coastal Orthopedics. And I'm so glad that you're here with me today. I know that your specialty is rotator cuff and shoulder surgery, but before we get to that, let's talk a little bit about where you were before all of this.
Sure. I grew up in Hickory, North Carolina, and went to undergraduate school at Wake Forest up in North Carolina, and then went to medical school actually out in Texas in San Antonio, and did my orthopedic training at the Medical College of Virginia in Richmond. And then I came down to this area, and I've been down here in the Conway area, actually in Conway for 20 years. So
this is home now.
This is home. I'm getting to be one of the old docs at the hospital, so that's scary.
Tell me about the other doctors, though. There are some that have been here just a couple of years, but your group runs the gamut, and they work on all different parts.
That's right, Diane. We got, what do we have now, 7 or 8 doctors. Dr. Haskin is the old man in the group. And then
he won't appreciate that.
I know he will not. And then I'm there. Billy Mills is our spine doctor. Ross Taylor does a lot of foot and ankle stuff. Dr. Curtis Elliott does some sports medicine. Our newest doctor is Dr. Peter Ramsey, who does a lot of total joints. We have our 2 physiatrists who are rehab doctors, do a lot of rehabilitation type work and pain management, and that's Dr. Jeff Wilkins and Aaron Watson.
So you really have someone there to assist anyone with any type of pain that they're having in their body, just about.
Pretty much can take it from head to toe. I don't know about inside the brain, but we can take care of the rest of it.
We will talk about rotator cuff a little later on, but I want to first talk about torn cartilages. You know, we seem to hear that when people have a knee problem, most of the time it's something like a torn cartilage. What is that exactly?
A torn cartilage is really a very common injury, and we see it in all different age groups. And the classic that people think about is the torn cartilage in the athlete, where the basketball player jumps up and comes down with a rebound and feels or hears a pop in his knee, and the knee gives out and it swells up, and that's the classic torn cartilage. And there's a model there if you want to look at that. We see the torn cartilage. I'm going to correct you there, and we'll turn it up.
Oh,
right
you know
side
what?
up.
That would help.
But you see torn cartilages in all age groups, because we'll see them in 60-year-olds and 70-year-olds, and really the treatment is the same. The cartilage is the cushion that interfaces between the 2 bones. So this is the cartilage in here, and when you get a tear, you tear that soft tissue there, and the treatment for it is, again, it's the same in a 20-year-old as it is for a 60-year-old. If you've got a torn cartilage, you take out the torn part of the cartilage. And the way I describe it for people to understand it is it's kind of like a hangnail, and the part that's sticking out, that's torn, is dead. It's got no blood supply and it can't live, just like a hangnail. And so why does a hangnail hurt? Well, it hurts because it's pulling on tissue that still has nerves attached and is still alive. And so a torn cartilage is the same way. You get a torn part that's sticking out in between the bones, and you're catching it as you're walking. And so the treatment is arthroscopically. You'll go in and basically smooth out that torn part so it's no longer getting caught, which is the same thing you do with a hangnail.
We do hear of young people having this a lot, and it is amazing.
It's a great operation for somebody that has a torn cartilage, and it really kind of gets most people back to their activity, and most people really do pretty well with that. So.
I'm sure you work with a lot of athletes in the community, as well as the person who just does a little jogging on the side or a little exercise. You see all sorts of people come in with this.
Exactly. Again, you can have the athlete at Coastal Carolina. You can have the weekend warrior who was running or playing soccer and messed up his knee. And then again, in this area, of course, you got a lot of 60 and 70-year-olds playing golf, and you twist wrong, you tear the cartilage, and it's the same type of symptoms.
How much downtime does someone have after a surgery like that?
It's done as an outpatient, so it's a same-day surgery, and usually you're looking at a week to 2 weeks of walking with crutches or something like that, and then really depends on your activity level, but anywhere from 2 to 6 weeks in terms of getting back to playing golf and other sports like that.
We're going to take a little break here, but Dr. Presslar, when we return, we want everyone to know we are going to continue our conversation, talking more specifically, though, about rotator cuff surgery or repair. We'll be right back.
The Conway Medical Center website provides visitors with a comprehensive resource for their health and wellness inquiries. From our homepage, just click onto Search Health Topics for direct access to the HealthWise knowledge base, where you'll find over 5,000 topics about health conditions, medical tests and procedures, medications, support groups, and everyday health and wellness issues. At Conway Medical Center, we know that better informed patients make better health decisions.
For over 50 years, it's been our mission at Garden City Furniture to offer our customers quality home furnishings at an excellent value and to provide personalized service that is second to none. You'll feel at home at Garden City Furniture on 17 Business in Garden City.
Dr. Arthur Presslar is our guest, better known as Jay, and we're talking about rotator cuff issues. And I know most people don't even know what a rotator cuff is, but boy, when they have pain in it, they know. What are some of those common causes of shoulder pain other than rotator cuff?
Yeah, you're looking at shoulder pain. Usually you're talking about pain that is anywhere from the top of the shoulder to about halfway down the arm. And so that's the area where when people hurt, we start to think that it's your shoulder. You know, sometimes people will then have pain that goes down the rest of the arm. That's usually not shoulder. So most of the time in terms of patients figuring out, you know, what might it be, it's pain in that area that we're concerned with. And then probably the three most common reasons for shoulder pain would be bursitis. The second most common would be the rotator cuff and a rotator cuff tear. And then the third would be arthritis in the shoulder. And you can get all three of those, but that's sort of the order that we see them in.
I'm just curious, though. You mentioned arthritis and bursitis. What's the difference between those two?
Well, arthritis means that the joint itself has deteriorated, and so you hear it much more in the hip and knees because that's, you know, you're walking, they wear out more. But that's, you basically are down to bone rubbing on bone, and so that can cause a lot of pain. The bursa is more of a, think of the bursa as kind of a sac in the shoulder between some of the bones there that is a sac filled with grease or lubrication that sort of allows the shoulder to move without much pain. And what happens in bursitis is it gets irritated and inflamed, and then it becomes a source of pain rather than preventing pain. And then the rotator cuff is sort of the tendon or the leader that attaches the rotator cuff muscles to the shoulder bone. And so it's real important in terms of function and being able to raise your arm and use your arm for daily activities.
You told me that sometimes people come in and they thought they broke their arm, but they've had an x-ray and it's not broken. And then that usually says to you, rotator cuff.
Right, that's very common, Diane. You'll have somebody who's had an injury, they tripped and fell, or they fell off a ladder, or they had a wreck or something like that, and they just had severe arm pain, severe shoulder pain, and can't move the arm. And so they've gone to the emergency room or to their doctor or whatever, and they got x-rays, and the x-rays didn't show anything broken, and so they're like, okay, well, it's not broken, so I'll just give it time. But very commonly, that would be a torn rotator cuff, especially if, you know, right after it happened, you really can't raise your arm or move it, and that's one of the things that really makes us think about the rotator cuff.
Will it gradually repair itself, or does it totally need some sort of surgery?
Yeah, that's a good question. The problem with the rotator cuff is that, again, it's a leader that's attached to the muscle, and if this is the rotator cuff and this is the bone that it's attached to and this is the muscle, what happens is it tears loose at the bone, and then the muscle goes into spasm and it pulls the tendon away from the bone. So probably 99% of the time when you've got a rotator cuff tear, it doesn't stay right where it's supposed to. If it stayed there, it would heal itself. But, you know, almost always it gets pulled away from the bone, and so it won't heal itself. So once it's torn, you pretty much have to do surgery to get it back working like it's supposed to.
And then is it basically what we know now as arthroscopic surgery?
What we do with the rotator cuffs is a lot of times we'll start out with always we start out with the arthroscopic surgery, and we look in there with the arthroscope, and then depending on how big it is will determine what you do. Most of the time, if I'm going to fix it, I will end up opening it with an incision that's 2 or 3 inches long to actually go in and pull the tendon back down and reattach it to the bone.
And then what sort of recovery time does that make for the patient?
Yeah, that's, of course, the big issue with rotator cuff surgery is the recovery after is pretty long. In other words, and that's something if you're going to go through the surgery, you got to go through the rehabilitation. But you're looking at at least 2 or 3 months, because really, again, what we do with surgery is just take that tendon and we reattach it to the bone. Well, then you got to give that a chance to heal, and so that takes usually about 6 weeks. Then after that's had a chance to heal, you've got to build the muscle back up because it's been disconnected for however long it was torn. It gets weak, so you got to build it back up. So really, for most patients, the rotator cuff surgery itself we do usually as an outpatient, and so they'll go home the same day. But then they're looking at again anywhere from 2 to 3 months of building that arm back up and getting the movement back and rehabilitation of it.
Do you find that most of the time, though, Dr. Presslar, they return to golf and tennis and all those things they thought they'd never do again?
Absolutely. It really is a good operation if you've got the right patient and if they're motivated, because generally after it's fixed and after it's healed, most people really get back to doing all the things they want to do. It's good for patients that have nighttime pain. A lot of times a rotator cuff tear will cause discomfort at nighttime, so it's a good operation for that in terms of trying to help people sleep better. But really in terms of function, like you said, golf, other activities like that, a torn rotator cuff can either keep you from doing it or cause a lot of pain when you do it, and so that can really help with that.
We can't thank you enough for the free advice today, Dr. Presslar. Thank you so much for being with us.
All right, Diane, thanks.
And we thank you on behalf of Conway Medical Center as well.
Thank you.